It was awful.
Oh, like it didn't even make any sense. I started laughing. I was like, yeah, that don't make any sense.
So we said orders, meds, procedures. Anybody think of anything else? Lunch. Hey, that's freaking right on. Lord. Patience. Orders. What do I mean by orders? What are orders you can think of? Discharge, NG2, O2, EKG, labs. So what if I said, okay, they written an order for labs. I want a potassium, I want a UA, and a CBC. Huh? The patient's heart rate is 135 and they're having chest pain.
Potassium.
There you go. Why? Do you see what I'm getting you to do? Did you know that beforehand, or did you just, I shocked you and you spit that answer out? Guys, you know more than you think you do. Tasks are procedures. Lunch breaks, hiding in the linen closet breaks.
Cool, bathroom breaks.
Bathroom breaks. In other words, what? Everything. Guys, that's God honest truth. Everything. I don't care where you were. I'm gonna work in the NICU. I don't care. In the NICU, in L&D, in the morgue. Which body goes first? I don't care where you tell me. I'm gonna do research. I don't care. You need a grant. Which one you gonna do first? You have to do prioritization. Guess what you use prioritization for that we didn't list? Test questions. Let me tell you how. I heard that. Somebody laughing at me from that back there. When you see this test question, if there is an answer on there and that patient either has this hellaciously chronic condition or they are absolutely stable and that is answer A, what are you going to do immediately with answer A? Get rid of it. Don't even look at it again, because y'all know what y'all do. I love y'all. What do y'all do? You go back to answer A and say what?
Well, maybe.
Well, no. The more time, I want to thump you in the no square. The more times you go back up there to answer A and say what if, the more times you might go up there and choose answer A. When you look at that and you say they're stable and chronic, get rid of it. Don't look at it again. This is test taking nursing 101. When you decide, commit, don't look at it again. And I know that's hard to do. And I know, yeah, it's hard and that's easy. Guys, I went through nursing school too, and I had to have somebody tell me this. I failed my first nursing test because my paramedic experience stabbed me in the foot. Who in here is either my Army medics, Army nurses, or has experience? I need to talk to every one of y'all before we take our first test. And this is just experience. Guys, I'm not picking on y'all. Your experience stabs you in the foot. Because we are the work, but what if? And you're going to think 5,000 miles down the road, I'm late for very, yes you are, and you're going to answer A, B, and C, and D, and ain't none of them the right answer.
No. Right here.
All right, so we got rid of the stable and chronic. So now what are we going to do? What What frameworks do we use? A, B, C, D. What'd you say? Maslow's? Huh? Y'all speak up on all of them. Maslow's hierarchy. Does everybody know what Maslow's is? You got all this down here and it goes up. What's at the top? That self-actualization. Guys, I ain't never got to that. I want to be on that mountain with Buddha, with the incense, and I hope someday I do self-actualization. Probably not. What's down at the bottom?
Air.
Who said it? What's down at the bottom? Airway.
Breathing, circulation.
Does anybody know another word for that bottom tier? What'd you say? You're cheating. Physiologic needs. What's at the top? It starts with a P. Psychological. Y'all cheating. Psychologic needs. Can anybody think of one time that psychologic needs trumps this?
Louder.
Say it louder. If somebody comes in the ER and says they want to kill themselves or you, what trumps airway? If I come in with a knife, you're the nurse, I'm going to kill you. I ain't worried about your airway. I'm going to ask you which way you running. Why? Because I don't want to run over you. Safety is first. You cannot get, guys, y'all cannot get hurt taking care of a patient. Who am I going to go to? I'm going to forget about that patient. It's going to, and you can tell me all day long, unless you hate that your student that you're in there with. Y'all have made friends in here, yes? You can tell me all, I'm going to do the right thing. I'm going to call you a liar, unless you hate me. Woo, that looks like that hurts. If you're friends, if Brenna is hurt, I'm going to tell you right now, I'm going to be torn if they're dying. If she's dying and they're dying, I'm telling you right now, I'm going to take care of her. It's just the way it is. Don't get hurt. Your coworkers will not take care of their patients. And if you tell me you're going to, I'm going to tell you you're a liar. Unless you hate that person. This is still physiologic needs. And it's still A, B, C, D. Now, did I say, so it is airway, breathing, circulation. What else is down there in Maslow's? Safety, shelter. So that's physiological. Where could water go? ABC, water, circulation. How do you fix circulation? IVs, water, circulation. Do y'all see what I'm telling you? Physiologic goes, what did I not say? Not safety. Now it is shelter. What else is down there? Come on.
Water.
Huh? What else is with that? Somebody look it up. Food. That's with all your basic. Or come on, start with that.
Yeah. Disability.
I'm not talking about this, huh? What? It is love and acceptance. What does it say? It starts with an S. Sex. Now, guys, that is, you can tell me all day long you don't care about it. Some of us can live longer with that. It's not just sex. What is it? It is companion. Human beings have to have physical touch. You can have a baby that's born, you can feed it, water it, sunlight it, and lay it in a bed. If you don't touch it, what's going to happen? It's going to die. It will, the back of its little head will be flat. It will die. I don't care how much you feed it. I don't care how much you water it. You have to have physical touch. Does it say A, S, B, C, D? If you can't breathe, you ain't worried about sexy time. After you can breathe, then you can worry about sexy time, right? It is A, B, C, D, but those are physiological needs, right? It's going to be quick after that for some of us, but not us. I'm too tired. These are your highest priorities, your physiological needs. How would I do my meds that way? Come on. What kind of meds?
Your cardiac meds.
Cardiac meds. Now, that's a good example. So when I say ABC, it's not just circulation, it's what? So, circulation is what? Can I get circulation without my cardiac system? Nope. I ain't got no pump. I ain't got no what? Circulation. So it's cardiac and circulation. So cardiac meds, circulation. It's the same priority. Cardiac meds is a priority. What priority is going to trump that? What kind of meds?
Airway.
Airway. What kind of meds? Oxygen. Who said it? Albuterol. Huh? There you go. Guys, we're going to get a pharmacology lecture. I'm not going to take albuterol anymore. And y'all can roll your eyes. You're going to learn these receptor sites before you get out of my class. It is not acceptable anymore to say albuterol. A monkey can tell me that. But you can tell me a beta-2 agonist. And I promise you, I don't tell you things without a reason. What's a beta blocker? Okay, what's it blocking?
Alpha, beta,
Okay, which one?
one, beta, two,
Beta 1, okay. So where is that receptor?
and the heart.
On the heart, okay. So I want to slow down what? The heart. Patient comes in with 160 heart rate. I'm going to give him a beta blocker, right? He's nervous. And you're right. Everything you said is correct. And that's awesome. This is why I need you to know that. He's a poor historian because he's scared to death. He forgot to tell you he has asthma. And you gave him a non-selective beta blocker. What did you just block? All of them. When I give him a beta-2 agonist, it doesn't work. If you didn't know that, what did you just maybe do? Now. And I've had to, Ms. Horton, I don't prescribe. I know you don't. But you critically think through these meds so that when the physician gives you the wrong order, you know better. Guys, what level do I expect you to be at right now? A novice nurse, a student nurse. I don't expect you to be at a 10-year level nurse. That's not fair. That's not what I expect you to do. But when I'm teaching you these things, I expect you to know them. You might not get it right the first time. Like I said, I'm not going to beat you. But as we get by the end of the year, I've had some of my students teach 10-year nurses. And I couldn't be more proud. Because that nurse was sitting there and she was all arrogant. And that student nurse made her look like a fool. And she just shut her mouth and walked off. And I rolled my eyes because she was trying to teach my students something wrong. Airway, breathing, circulation. I don't know why they call it this. Is this like disability like we think about disability? What is this? It is, it's neuro, but it's what? Altered what? Mental status. Why is that an emergency? What can this lead to?
All of them. Yeah.
If I have a bad altered mental status, what can I not control? My airway. I can't swallow my own spit. And when you walk in, I'm not following commands and you go, What am I going to do? Aspirate and choke. What do we have to do immediately? Intubate. This is critical, but there's 2 times something else comes before that. So you could have told me it's critical versus urgent. Okay, we're going to go right back to this. There are other models, but it comes right back to this. If you will just think about this. So you told me beta-2 agonist versus labetalol. Cardiac. Airway. So patient comes in, has a positive, fast screening. What is that? Stroke symptoms. So we're going to give them streptokinase. What is that? Somebody look it up. TPA.
Clot buster.
Clot buster. I'm going to give them a clot buster. This is not a trick question. I'm going to give them a clot buster. I'm going to give them aspirin. Think about it. They have a clot in their brain. Why? Am I going to give them aspirin too?
Yes.
Probably. What's more important? Dissolve the clot. Guys, these are the questions. Was that a trick question? It was not. These are the type questions NCLEX will give you. It's not a trick question. Take every question at face value. Do not read into these questions. That's not a trick question. It makes you think. And then after that, everything else. A lot of times, what's at the very end? Unfortunately, and they're going to get mad at you, that patient down in room 6, because they won't go home. Discharge and education, it's just the way it has to be. Because the one in room 3 can't breathe. And are they going to yell at you? Yup. Especially if you're in the ER or the ICU, they mad. They can't go home. They may ask to see your charge nurse. You might get a bad eval. That's okay. We're going to have to take it. It's part of the things that happen. NCLEX is going to give you these. So you go down there, you got somebody who had abdominal surgery, pain of 3 out of 10, somebody who has a COPD exacerbation, O2 sat is 90, somebody who you go down there, they have a GCS that was earlier, that was a 10 out of a 10, now it's an 8 out of a 10. Which one are you going to see first? Which one of those do you expect? COPD, O2 sat of 90? That's probably a little bit high for them. My mama had it, she smoked 4 packs a day. Right!
She didn't guess it, she gave her something.
You know what hers was on a good day? 88. Girls' hair was 90. I was like, damn, we doing something. That's expected. What about my abdominal surgery? Do you expect a 3? Now, what if I said it's an 8? No. Anything above a 5 is not expected. What about my GCS changes? It was a 10. Now, is that a big change? It's not. But it's an 8. GCS lower than 8? Intubate. I cannot control my airway anymore. Even a slight change. Guys, when I say these things, if you don't give me the answer, that's okay. But I'm trying to get you to see these trends. Now, if I would have made that obvious, and NCLEX is not going to, if I said they were a 10 and now they're a 2, that would have been a run. Call somebody, everybody, and God. Routine task. Hey, can you go change the Foley in room 2? Okay. This is important as well. Guys, I don't disregard the nursing process. I really don't. I'm a paramedic at heart. You will see me sometimes trying to teach you, and I will pause. Sometimes I do forget things. I'm trying to decide which side of my brain to teach you with. We have to teach paramedics different. They have to, the first day they step out of the truck, they have to be able to function at that level, or they will get killed, or they will kill somebody. It is just different. No better, no worse, just different. I first started teaching, and Dr. Wilkes said something about the nursing process, and I stared at her. Why? I couldn't write it down. Did I do it every day? I did. I didn't know what the steps were. I learned it, now I know it, I think. But do you know what the NCLEX study kind of said? All of it's important, I don't want you to think that. But there's 2 steps they focused on. Assessment and what? Which one comes first? If you don't know what's wrong, can you do the right thing? If I'm the nurse practitioner, what's your name? Nalea. Hey, can you go down and give that patient in room 30 some labetalol? Thank you. You gonna just go give it? Why? I told you to go give it. Can't you go give it? What are you gonna tell me? Nicely. Right. Now, are you gonna be ugly? No. I love my patients so much that before I give this order that you're being a butthole about, no, we'll say that, but that before, you know, I love my patient so much, I'm going to go check her blood pressure, because if I was to give her that medication, it would kill her that you're asking me to give without checking her blood pressure. And so when I come back and her blood pressure is 90 over dead, I'm not giving that med. And she's like, I need you to give that med. What's your name? Let me see your hand. I tell you what, here's that labetalol. Her blood pressure's 80 over 20. You can go give it. Is Taylor going? She's a nurse practitioner. She gonna give it? Nope. She's gonna turn tail and stomp back down to the nurse's station and not give it. Y'all ain't even got a license yet. Protect that license you ain't got. Just because they're a physician, they're a nurse practitioner, they're a PA, does not mean they know more than you. Educate yourself on these meds you're giving. If you don't know, look it up. Who is your best friend that works there with you? Who you going? Honey, you know how many times I love the pharmacists. They got to know me by my first name at Vanderbilt. Can you know all these meds? No. They tell me to, hey, can you go give Neil stigmine? What? What's he gonna do? I don't know. So then I'd go ask Brenda, because she's been a nurse a long time. She's like, I don't know. And you ain't gonna call it. And so they love their job. You're gonna be on the phone for a minute. But they're gonna tell you how fast to give it. That drug is gonna have some side effects that I didn't know about that you need to be prepared for. Do not get yourself in trouble because you're giving a medicine you don't understand what's going to happen because you think you should. What is this? Why do I have that up there? It's not backstabbing. Why am I have this up here? Is that safe? Or the nurses see everything that happens? If you see something, say something. How many weapons do you think get brought into the emergency room that we don't see? How many do you think when we're working a full arrest, that was a gang shooting slide out on the floor? That's a loaded pistol. If you see, what if you're wrong? What if you're right? I worked in Greenville, Mississippi, and y'all gonna tell me that ain't, yeah.
I worked more shootings and stabbings in Greenville, Mississippi than I did in Memphis. Yeah. I didn't work the, I don't know if this, one of my partners is working a gang shooting. The guy was critical, he was dying. They were trying to save him. He hears a voice over the back, this shouldn't have happened. Is he gonna die? I'm gonna try to do everything I can so he doesn't. This is the person that shot him, and he told one of my co-workers to step away. My partner had enough God-given sense too, and he came over the back of him and shot him 6 more times. Now, should that have happened? He got into a zone that he should not have been, but shit happens. If you see something, say something. Guys, this is dangerous. Everybody's got a weapon. Everybody's got stuff. Don't play no hero, though. Don't get shot. Safety. What order do we go in? Whose safety's first?
Your own.
Yours. Then what? Not your patient. What? Your partner, your co-worker. Then what? Patient. Then what? Bystanders and family. It's the way it is. If I get hurt, who's going to take care of me? My co-worker. And the family ain't going to get, and the patient's not going to get taken care of. If me and my co-worker get hurt, who's not going to get taken care of? Patient. Guys, we have to not get hurt. What is the order of preference in active shooters? What do we tell you? Run, hide, fight. I'm telling y'all right now, if we in this classroom, because I'm tired as shit of this, if we have to shelter in place, I'm fighting first. Because if I'm serious, if they get in this classroom, a lot of us are gonna die. I ain't doing it no more. Now, I'm telling you, if we can get out of this classroom, we running. I can't run that fast, but we running.
I'll carry you.
But here's the thing. If we are in that hospital, and that is the hardest thing to do, because what are we supposed to do? Take care of them. If we all get killed, we can't take care of them. We have got to leave. Say it if you want to, but if you get killed, we can't take care of our patients. What are we going to do then? We're gonna leave, but what are we going to do? Once they get the threat neutralized, we will come back. If we can hide and help, we will. You can't get killed in the process. And I know that's hard. But you have to make that decision. I hate this. It hates me. All right, let's try it. The beta law. Blood pressure 150/98. I need an extra blanket. 32-year-old patient, stat order, beta-2 agonist for a COPD exacerbation. Which one?
Number 3. Number 1.
Why? Why does it trump
Airway.
one?
Airway.
Yeah, but what is that med for? A, B, or C?
C.
Right? But is it urgent?
What's urgent for that critical?
So, what would have made that urgent? How could I have written that question to change this? What would I have taken out here? I would have taken that out and that out. What would I put up here? Guys, this is how I write these questions. That's not fair. I will not do that. I am not going to trick you. I'm trying to show you how I write these questions. That's how NCLEX write. We practice at this. Guys, I'm not perfect. I'm not. I do not trick you. I will not put stat order, beta-2 agonist, COPD, stat order, the beta law for 300 over 150. You couldn't answer it. Now, it says stat, right? But what's their blood pressure? That's not stat. Did that, they probably wrote it wrong.
They need it. This one needs it bad. It's airway. That's how you decide on test questions. Orders. Now, did I give you anything else? Don't stop. Everybody look at me. Face value. Don't read into it. Nothing. Orders. Which one? EKG? Be careful. EKG? Telemetry? Hospital admission? There you go. Guys, is this important?
Yeah.
But in the grand scheme, has anybody ever been there when they do a hospital administration? When does this get done?
It's left.
Guys, it is. What kind of meds are these?
Home meds.
Now, sometimes does this get pushed off too long? It does. Face value. What is this? Why?
It's the heart.
Yes. This is not reading into this. You have an order for this? They think it's important enough that the patient is put on what? Is that reading into that? No, it's not. I have an order for it. I also have an order for an EKG. This is now. This is now. What does this look for? Heart attack. Does this look for a heart attack?
No.
No. I want to make sure that they don't have any changes. Trends. Heart attack. Trends. Absolute in emergency. Could be an absolute in emergency. Not an emergency. Could turn into an emergency. But that's reading into the question. Do you see what I'm telling you about these questions? Labs. UA, potassium, PT, PTT, serum. What is this? Pregnancy. Which one first? Which one second? Which one third? Which one last? I need a stat, CT. Why? Do you see how it changed?
No.
Now, I didn't give you anything, right? My patient is having awful dysrhythmias. Potassium. My patient is not having any problems with their heart. We've done an EKG. We've done everything. They have a serious altered level of consciousness. What am I going to include in that? Top screen. What if I added an AccuCheck up here? Which one would be first? How quick can you do that? Am I going to need a urinary drug screen?
Yeah.
Which one would you pick first if I had a UDS and an AccuCheck? AccuCheck. Guys, pick the one you can do fast. Does that make sense? That's prioritization. Guys, I know this. You're going to do the AccuCheck and somebody's running to go get the Foley, right? Because if you got an altered level, can you pee in this? No, I can pee all over you. Do you see what I'm saying about prioritization? It's not always cut and dry. I have to give you those quantifying little tidbits so you can make a choice. If it's not there, you know which one to pick. I always have to involve this when this is only relative to trauma. If it's a medical problem, I ain't worried about trauma. If you didn't dive off the house, hey y'all, watch this. If I have a high-level surgical step-off fracture, which means here's C2 and here's C3, if you sneeze, what happens? Complete transection of the cord. I didn't have an airway problem. I surely do now, and there ain't nothing you can do. If you don't immediately intubate that patient, what? They die. Below C4 and 5 keeps you alive. It's game over if you didn't control C-spine until you figure out that there's nothing. Guys, I'm not going to trick you with that, but you need to realize that, especially if you work in an emergency room. Airway, breathing, circulation, and cardiac.
disability, I like to say decreased level of consciousness. Oh, guys, this ain't exposure, not stripper pants, not exposure. What does this mean? If you didn't look at it, if you didn't write it down, you didn't do it. If I didn't take their clothes off and see that they've got bruising in different stages of healing, then you don't know what. But it might be non-accidental trauma. I had a bad trauma patient come in one time in a hospital. The paramedic said, pulse motor sensory times 4 is intact. Everybody's seen those sexy cowboy boots, they $400. He still had them on. And they's tight. I pulled him aside and I said, how did you check his? I checked his fetal pulses. I pulled him in there and pulled the cover back. His eyes got real big. I said, you want to tell me how you checked his fetal pulses? Don't do it. Don't chart what somebody else charted. Y'all better not. Breast downs are there and present. I used to have a patient who had had lung cancer and he had a lung removed. He used to love the nursing student to come in there because he used to be a physician. And he would call me in there if somebody said his breast sounds were present. Because he wasn't being ugly. He was trying to teach you a lesson. One time, besides safety, the A don't come first. What is it? It's not just bleeding, it's what? Starts with a C. Catastrophic bleeding. I want you to remember the 5 C's. Maybe. Guys, if y'all need to stand up, stand up. I know we're flying through this, but next classroom we have civility day and we're only going to be able to lecture an hour. There's blood on the concrete. They ain't supposed to be blood on the concrete. The clicker don't work.
One of the 5 C's.
Yeah. Blood on their clothes, a lot. Blood on the ceiling. Blood clear across the room. Now, what kind of bleed is that? It's arterial. Has anybody seen a bad venous bleed? Now, will it kind of soak their clothes? It will. Has anybody seen a bad arterial bleed? It soaks their clothes. Now, y'all, some of the videos and pictures I'm going to show y'all are very graphic. And I'm not... Who said that? Especially when we get to the burn. And guys, I post these videos. My son was sitting there, he's 9. He's like, Mama, that's a little aggressive. Guys, you might not want your children to look at these. I mean, my daughter's like, huh, that's interesting. So I'm giving you the disclaimer now. Some of this stuff is a little bit hard for children to look at, so don't let them look at it. All right, when I start showing this, I want y'all to start counting until the woman passes out or hits the floor. How long?
6 seconds.
So you can't see it. That guy shot her. I'm gonna rewind it. Right there. What did he hit?
Jugular.
I'm gonna rewind it and try to stop it. Wait. Right here, he's just gonna shoot her. He shot her. I don't even think she knew it. Blood on the
Concrete.
concrete. I don't even think she knew she'd been shot. All right, this one is overseas somewhere, and they. So he's fixing to get shot. Hold on.
Start counting. Hold on. When y'all hear the gunshot, we're going to start counting. Wait a minute. Right there. Start counting. What do you got this guy? I don't know what he did. Blood on the blood on his clothes. How long? How long? How long?
35?
Like 35, 40 seconds. They shot him in his femoral artery. So why, like the other one, I mean, it was definitely game over. Game over. I think he stole something from that guy. But girl, didn't nobody help him. I mean, I don't think they could have saved him anyway. But didn't know, like everybody's just standing there like, I hate it. Like, I hate it for you, bro. I know. Well, yeah, that's a good point. He did have the gun. Like, I ain't gonna help him. He might shoot me. What is the definition of ventilation? Moving air what? In and out. What is airway? It's the path. Did I say breathing? I did not. If you trying to get in the door to move your couch and the door is blocked, are you getting your couch in? No. You can knock on it all you want to, and they ain't gonna let you in. How do I block the airway? Trauma.
Constriction.
Allergic reaction. What does that do?
Swell.
Which airway? How many airways do you have? They're separated into the upper. What kind of breath sounds are lower?
Wheezing.
Wheezing?
Crackling.
Absolutely not. Strider is upper. They high-fiving back there if y'all can see. She's like, I'm glad I'm sitting by you. Now, the first thing, if I walk in, so this is already, this is called the primary assessment. I don't care where you're at. And guess what the things are that you are doing during the primary assessing? A, B, C, D, and E is down there. I'm going to walk up to this gentleman. What's the first thing I'm going to look at? Is his airway even
Clear.
open? If he says, what do you want? Is his airway open?
Yes.
Yep. If he's going, ah! Is his airway open?
Yes.
If he's going, is his airway open?
Not necessarily.
Maybe not. If he's going, is his airway open?
Maybe not.
Kinda, but is it patent?
No.
Nope. What's the first thing you might do? Guys, I'm a very touchy-feely person. And I had to learn that I need to ask. I will never touch you inappropriately, I promise. But I had to learn that I need to ask you. So if I walk up to you, and I've kind of learned, people, that if I walk up to you and you're doing this, I'm not going to touch you. If I ask and walk up, then I want to show the class something. If he's doing, what am I going to do first? If I walk up to him and touch him, he says, "Ah!" He's just sleeping, or he might be drunk. But if I touch him and he doesn't do it, hey, Mr. Jones, nothing, and he's doing that, what I might do first? I might try to do this if he's still going. I'm going to call for some help. Is his airway open? Not really, and it's certainly not patent. What am I going to start looking for? Does he have something in his mouth? I'm calling for help. I'm going to try to open his mouth. Am I going to immediately stick my piggies in there? No, I don't want to get bit. I might try something to open his mouth by doing a head tilt chin lift and kind of bringing his jaw forward. Guys, that hurts a little bit. If he's just a little bit altered, they might start swinging, so I need some help. But if he is truly not controlling his airway, there's things we need to do. Is the airway open? Not just is it open, is it patent? Is there some? This is, if I find a problem, I need to immediately fix it. How do we fix it if it's not patent? Besides mess things up on the PowerPoint. Huh? Oh, a lot of the PowerPoints that you see from me and that are downloaded, I take y'all's evals that you do, and I know y'all are evaled out. I get it. And y'all can think that I don't, but you can talk to the senior students. I take the evaluations y'all write, and I have printed every one out because some of the student, if you tell me Miss What's a bitch, I'm not gonna pay any attention to it. I might be, but you didn't write. But if you write in there, Ms. Gordon, you are using too many colors in your PowerPoints, I stopped doing it because it was distracting. Every one of my PowerPoints are laid out the same way. Pathophysiology. I am huge on pathophysiology. It helps you understand everything. Presentation. What does PI is what I go by. What does this patient present look like when you walk through the door? If my airway is affected, what are they going to present? Maybe. What is that breath sound called? Snoring or gurgling. Anybody here got a significant other, mama, daddy, sister, cousin, brother that snores? What causes that? Your wife don't like it, does she? Or your girlfriend and all. What causes that? Anybody ever heard the old folks say, they swallowed their tongue? You kind of do. When you got an altered level of consciousness, what does your tongue do? That's why you have snoring. What is gurgling? Something is back there. Snot. What else? Saliva. Blood. Vomit. Chewing tobacco. This morning's eggs. Something is back there. I'm finna throw shit. Oh Lord. Guys, I promise we're gonna get the rest of this next class period. Y'all go ahead and look over this presentation and look over the pharmacology part, because next